It's now 3 p.m. I call to order a meeting of the Health Services Panel, election of the chairman. A reminder for members, please note that under Rule 77(6), a member who is the chairman or deputy chairman of a government advisory body in respect of matters which a panel considers to be directly related to terms of reference of the panel, he shall not be the chairman or deputy chairman of this panel. And under 77(7), a member shall not be chairman or deputy chairman of more than one panel at the same time. A dozen or so members have been nominated in other panels and yet not elected or returned. So under the ROP, they are still entitled to be nominated and elected in this panel. But of course, it's up to their nominating members and supporting members whether they should be nominated. Dr. Kwok Ka-ki, I nominate Dr. Joseph Lee. And the seconder, Mr. Chew Ka-chun. Mr. Michael Lee, do you accept? I do. So the nomination is valid. Any other nominations, please? Okay, I'll count to 3. 1, 2, 3. Okay, since we've got only one nomination, I declare Dr. Joseph Lee elected. Please take the chair. Thank you very much. Next, we have to elect the deputy chairman for the panel. According to our rules of procedures, we need nominations first. Dr. Kwok Ka-ki? Yes. I nominate Dr. Pierre Chen. Dr. Pierre Chen, Pui Yin. Any seconder, please? Mr. Chew Ka-chun. Any other nominations, please? If not, then we've got only one nomination, and that's Dr. Pierre Chen. And if we have no other nomination, I declare Dr. Pierre Chen elected. Thank you very much. After election of chairman and deputy chairman, we have to fix the schedule of meetings for 2016-17. In our last term, we met on the third Monday of each month at 2:30. If members have no objection, we will follow our previous arrangement. We will meet at 4:30 on the third Monday of each month. And then the Secretariat will inform you of the exact meeting dates afterwards. Agenda items for our next meeting. Members, do you have any suggestion? Do you have any issues that you would like to take up with the administration? Ms. Chang Han-peng, Chinese Medical Hospital. While the administration has talked of building one, we have not seen any progress. And secondly, regulation of health food products. I'd like to take this up in future meetings, and many organizations have sent us email on rare diseases. I want the administration to discuss with us the issue of rare diseases. All right, Chinese Medical Hospital, regulation of health food products, and rare diseases. I hope we can follow up on the regulation of cosmetic services and residual of heavy metals and chemicals like sulfur in food. Prenatal services for pregnant women in Yunlong. Regulation of health food products. And also like to follow up on the concern group for sexual abuses against women. They're very concerned about the assistance rendered to victims of such offenses, and they want HA hospitals or clinics to take over the services to such women. All right. Services for pregnant women in anti-West, cosmetic services, and other things. Ms. Tania Chen, we have seen Zika disease in many Southeast Asian countries. However, we have not discussed this disease so far. So when the time is right, I hope we can invite the administration to report to us as what preventive measures have been taken to prevent the disease. In fact, we had a discussion in the last quarter. I know they will come back to report their progress to us. Dr. Elizabeth Quat, in last term, we passed the e-health records ordinance. We know that there will be phase 2, and we've asked to expand the right to access such records. So I'd like to have another discussion of this issue. And many members of the public would like to have public dental services. And in NT-East, it is disastrous area as far as public health care services are concerned. We'd like to know what plans there are to improve the situation, and also the establishment and strength of nurses. We also want to have general screening services for breast cancer and risk-free prenatal examination as well. E-health records. The administration has the duty to report to us the progress. And healthcare services in NT-East, screening for breast cancer and public dental services. Yes, we'll ask them to follow up. And what about the aborted medical practitioners amendment bill? Can we set up a committee under this panel to discuss not just that bill, but also an appeal mechanism for dealing with medical incidents? When it comes to the setting up of such a subcommittee, I will discuss with the administration the terms of reference and also the timetable first before I get back and report to you. Regarding complaints against medical incidents and also amendments to the medical practitioners ordinance, we have been following up on that for a few years. Dr. Kwok Ka-ki, just a minor point. Vaccination of the flu against flu in schools. This is quite a pressing issue because November is around the corner. At the coming meeting, can we be given some information from the administration as to plans of hospitals? All right. Flu vaccination. The administration has got 2 proposed agendas for the next meeting. First, preparation for the flu peak in the coming season, and also fees and charges of private hospitals. We will forward your views to the administration for its consideration. Mr. Jeremy Tam. Policy on rare diseases. Since Ms. Claudia Mo is here, I have to pronounce the word more accurately so that she will not laugh at me. And I think we should advance the discussion of this item to an earlier date because I have received assistance or requests for help from families with patients suffering from rare diseases. They would like assistance to be given, and the drugs should perhaps be included in the drug formulary. Let's see if these two can be discussed together. There was a motion debate on rare diseases in our last term. As regards the order of discussion, I'll let you know our decision after discussion with the administration. Mr. Chiu Ka-chun. What about the voluntary registration scheme for clinical psychologists? Will it be included in number 5 of our list? Towards the end of our term last time, the administration indicated that they were doing something about this and they would report the progress to us later. Okay. Dr. Kwok, you still have something to add? Please switch on the microphone for her. I also like to discuss our policy on organ donation. All right. I think we have more than 40 members in our panel. You all have your own concerns and requests for discussion. I will discuss with the administration, and then we're going to prepare another list for our next meeting so that you will know the sequence or the order for discussion. And we'll discuss with the administration on whether there will be a reshuffling of the order. And next time we'll let you know exactly what the list will be, the order of the list will be. The administration has suggested that in the list the following items can be deleted. Reorganization of directorate grade in the hospital services, and also provision of, or rather, the dual-track approach between the public and private sector in our system, and also the voluntary, and also another item. Dr. Kwok, well, we should not just allow them to delete any item as they like. And as for the provision of private wards in public hospitals, I don't think we have had a thorough discussion of that. We should not allow them to delete it. Yes, that's their proposal. That doesn't mean that we have to follow suit. I just want to let you know that they want to delete these 3 items. For instance, if we want a rediscussion of measures to tackle the contamination of our lead contamination of water, yes, we'll let them know. And public patient services in HA, yes, these are the items that they want to remove. In other proposals, yes, it may be premature to decide. There are about 20 new items proposed today. Together with those written on the list, I'm going to discuss with the administration the order for discussing them. AOB. All right, we've completed our meeting within 15 minutes. Thank you very much.